Hello, my name is Dr. Leon Foo. I'm from Island Orthopedics, and in this video I'll be talking about osteoporosis. So osteoporosis is a medical term describing the process in which bones weaken, and they weaken to such an extent that they are easy to break. So bone is actually living tissue, so even as we speak right now, bone is being formed and destroyed at the same time. And osteoporosis occurs when there's a net destruction of this bone. Now, the main concern with osteoporosis is what we call fragility fractures, and they typically involve the hips, the shoulders, the spine, and the wrists. While the vast majority of the patients with osteoporosis are the elderly age group, there is a subset of patients who are young. So you have them in the 20s and 30s, even the 40s. And these patients, the osteoporosis is often due to a secondary cause. That means there's another underlying medical problem, and the problems can be quite varied. So generally, osteoporosis progresses very slowly over many years. But for the subgroup of secondary osteoporosis due to underlying medical conditions, that's highly variable though. Some of them can be quite slow and they can take many years to develop, and others can be quite fast in a matter of months, especially those that are medication related. Well, osteoporosis is actually also known as the silent disease, and it's called the silent disease simply because patients don't have any symptoms. So there's no pain, you have good function, you won't know you have osteoporosis, and often you don't even suspect you have osteoporosis. But having said that, there are certain risk factors that can alert you, and if you have them, then you should see a medical professional for at least an assessment or follow-up to make sure you don't have early onset osteoporosis. Yes, osteoporosis definitely can be prevented. In fact, in this day and age, we're looking more and more at preventive health. So the old adage that prevention is better than cure holds particularly true for osteoporosis. So with osteoporosis, in particular for young ladies, it's important that they build up their peak bone mass. So the analogy I often give to patients is like saving for retirement. So if you want a comfortable retirement, you have to work hard in the early years. Same with osteoporosis, prevention, that is. You need to work hard in the early years to build up your peak bone mass by watching the 4 key ingredients: calcium intake, vitamin D intake, adequate sunlight, and adequate weight-bearing exercise. So if you feel that you may have osteoporosis or are concerned that you may have osteoporosis, please feel free to approach any of our specialists at Island Orthopedics. Thank you.